Hello, my name is Schell Martinez, and today I will be presenting a paper I co-authored with Dr. Charlotte Tang, The Impact of COVID-19 on LGBTQIA Individuals, Technology Use to Seek Health Information and Services. Our study found that the pandemic greatly affected technology used to seek health information and services, further increasing the health disparities LGBTQIA individuals experienced during this vulnerable period. Many of our respondents not only relied on technology for their health information, but due to the pandemic, also depended on it for most of their other health needs. Today, I will provide some background to what led to our research, the methods we used, some of our key findings, and the socio-technical implications of those findings. I would like to also recommend viewing this in full screen mode. Otherwise, some of the labels on the charts may be too small to read. Pre-COVID, the LGBTQIA community experienced more health disparities in comparison to the general population. They experienced higher rates of anxiety, depression, suicidal ideation and self-harm, financial obstacles to obtaining care, discrimination and harassment in the medical setting, transportation barriers, which then led them to investigate health information and services online more frequently, and to seek support and personal medical experiences from other members of the community on social media. Our participants were recruited through direct emails and digital flyers posted on local university, regional, and national LGBTQIA organizations, centers, clubs, and support groups across the United States. We received 155 completed surveys. Both qualitative and quantitative data were collected from the respondents over the age of 18 who self-identified as LGBTQIA. There were 70 close-ended questions and 19 open-ended short answer questions to elicit information about their demographics, their LGBTQIA identity, health information seeking behaviors, their health insurance, and prescription drug access. Questions related to their mental health and primary care access in relation to the pandemic and technology use were also investigated. Not all questions were answered by each participant. Questions may have been skipped based on their earlier responses. Descriptive statistics were used to analyze the quantitative data, and bivariate analysis was then conducted between the general population and our respondents. Affinity diagramming was used to analyze the narrative data to identify emerging themes. Our sample, unfortunately, was not representative of the United States population with respect to age, race, ethnicity, and education level. Caucasians and Asians were overrepresented. Blacks, Hispanics, and Native Americans were underrepresented. Our study's cohort was very young. 62% of our respondents were under the age of 35, and 77% were under the age of 45. This skew is likely due to the use of digital media for recruitment and to conduct the study. This was a highly educated group of participants, which may have increased their comfort level with and their use of technology. Due to the digital recruitment method, because of the pandemic, we may have left out those who are less tech savvy and those who have limited internet access. This may also explain why many of our respondents were young, highly educated, and comfortable with technology. Gender identification and sexual orientation are clearly a wide spectrum that is often fluid. 57% said their sexual orientation had changed over their lifetime, and 42% said their gender had. Despite increased acceptance, inclusion, and representation of LGBTQIA individuals, only 59% considered themselves fully out in their personal and public lives. This speaks volumes to perceived acceptance when 41% are not comfortable being out to everyone they know. General population comparison data will be shown in the small circles marked with verses throughout this presentation so that you are able to easily see comparisons. So slightly more LGBTQIA respondents had health insurance coverage than did the general population. Nearly 20% of the general pop lost their employee-sponsored insurance due to COVID, significantly more than the 3.4% of our respondents who had. It appears that COVID-19 had a lesser impact on health insurance coverage for our LGBTQIA respondents than the general population. This may be due to the higher education level of our respondents, which provided the group with higher job security. Despite the LGBTQIA community having higher percentages of individuals covered by health insurance, they experience significantly more health disparities than the general population did. Our research found LGBTQIA individuals are more likely to perceive their health status as fair or good, placing their perceived health status in the middle of the health spectrum, despite a higher percentage having health insurance coverage. This may indicate that they are experiencing accessibility issues besides those related to health insurance coverage. According to the PR Newswire survey done in April 2020, 75% of the US general population had reported that COVID had negatively impacted their mental health. 87% of our respondents said it had impacted their mental health negatively, with over 40% expressing they experienced a great deal of mental health challenges due to the pandemic. Several respondents indicated that their mental health issues had greatly interfered with their daily life. 40% of the respondents had sought out mental health services to help them cope with the impact caused by the pandemic, and 10% of those were first-timers in seeking mental health assistance. COVID-19 impacted health information seeking strategies and accessibility for 27% of our LGBTQIA respondents. Some participants had to increase their reliance on the internet, and some solely sought health information online due to decreased in-person access to their normal sources of health information. Other respondents had become more reliant on family and friends for health information, which was not the case for them before the pandemic. Unfortunately, for a small number of our participants, the health information they needed was inaccessible due to the constraints rendered by the pandemic. The pandemic also impacted the types of information sought. General COVID-19 information was the third most searched topic, just behind general health and prescription drug information. A few respondents mentioned specifically increasing their research on how to stay safe from COVID-19. And some stress the importance of using only official health sites to find that information. A few others mentioned they had researched in-person appointment safety procedures and protocols that had been instated due to the pandemic. Transportation has often been cited as a barrier to healthcare access, which undoubtedly was further complicated by the pandemic. 60% of our LGBTQIA participants own their own vehicle, considerably less than the 85% of the general population in the US who owns a vehicle. Over twice the number of our respondents relied on public transportation than did the general population. And with our respondents, 9.1% used subway and 2.4% relied on public buses for their public forms of transportation. A few respondents indicated that they no longer use public transportation or ride shares due to the pandemic, while others expressed an increased reliance on walking, roommates, and Uber. Our respondents experienced a more significant reduction in access to healthcare than the general population did. 25% of our respondents had trouble seeking health services due to COVID. For many, in-person appointments were replaced by virtual consultations as safety regulations rendered the facilities to close or reduce their hours. Transgender people were especially hit hard by the reduction or elimination of in-person appointments because it also changed, reduced, or eliminated their access to their normal hormone replacement therapy. Some ended up with no medication. For others, it resulted in prescription changes that often involved transitioning from injectable hormones to an orally or topical administered hormone. As a result, many experienced increased stress to the body, both physically and mentally, due to the sudden change or stopping of these treatments, and often needed additional care to combat the adverse effects caused by it. Over 1/3 of LGBTQIA respondents had their mental health appointments postponed or canceled due to the COVID-19 pandemic, whereas only 22% of the general population experienced a reduction in mental health services. Nearly a quarter of our respondents had their appointments canceled or postponed by their primary care providers due to the pandemic, and 1/3 canceled or postponed appointments themselves with their primary care providers to minimize possible exposure to COVID-19. The LGBTQIA community experienced a disproportionately higher rate of inaccessibility to prescriptions due to the pandemic, significantly more so than the general population. Nearly a quarter of the LGBTQIA respondents had to change how they received their prescriptions, with 3/4 using mail order to minimize their risk of exposure. Some individuals had experienced lengthy fights with their insurance companies to get their mail order prescriptions covered, sometimes weeks after receiving them and having pre-authorization for coverage. Others used the pharmacy's drive-through or curbside pickup options, but the reduced hours of operation increased the difficulty and required better coordination with rides or family members in order to secure prescriptions. A few respondents had to switch pharmacies because their previous pharmacy had been near their place of employment and they were now working from home virtually or no longer employed with that company. Over 18% of our respondents had difficulties getting their prescriptions due to the pandemic, substantially higher than the 3% among the general population. 55% of those experiencing accessibility issues were individuals whose gender identity had changed over their lifetime, and 35% identified as transgender specifically. Some alternatives were prescribed as discussed earlier, but for some, even the workarounds were not available, forcing them to go without their medication until the pharmacy had stock again. One respondent described in detail the multifaceted, unsuccessful attempt in securing their prescriptions and the subsequent physical toll on their body, including an attempt to take their life by jumping off a bridge. Some respondents were unable to get their medications due to transportation issues. Relocations due to the pandemic forced some to have to drive to different towns to access their prescriptions. Others were unable to travel to a pharmacy that would actually take their insurance. One participant had been relocated to a different state, which required them to get a prescription reconfirmation before they could refill their prescriptions in this new state. Others delayed getting their prescription until absolutely necessary because of fears of being exposed to the virus. One respondent, who was forced to move back home with family due to the pandemic, had not filled or taken their prescription since returning home because they worried their family would discover their need for antidepressants. 90% of our LGBTQIA respondents who received mental health care during the pandemic experienced a change in the platform for their appointments, twice the number experienced by the general population. 75% of them were satisfied with the platform change, and 82% were satisfied with how their mental health professional handled the pandemic. 58% of respondents experienced a platform change with their primary care provider appointments, and over 70% were satisfied with the change. Several benefits were mentioned: not having to commute or fight traffic, reducing their travel time, and the time they needed off from work. Cost savings from the lack of travel and through waived insurance copays for telehealth and virtual visits. It created an ability to access a nationwide pool of virtual LGBTQIA-friendly and knowledgeable providers, and empowered some individuals to be able to quickly end condescending or discriminatory interactions with both new and seasoned health professionals. Some enjoyed maintaining their health virtually from the comfort and safety of their own homes. But not all respondents enjoyed the platform changes. Some struggled to find a private space for virtual health appointments, forcing them to sit in their car to try and ensure privacy. Many felt the telehealth experience was impersonal, uncomfortable, and minimized the ability to read body language. A few even deemed them less productive than in-person appointments. This method exhausted some more than their normal in-person appointments did. A few respondents who had experienced technical issues became frustrated as some of their providers, in an attempt to improve care and access, had constantly changed appointment formats and software, leaving the patient to struggle with new technology at each appointment. Despite their relatively young age and high education level, many experienced technical difficulties when interacting with their healthcare providers virtually. Poor internet connections, slow speeds affected their ability, as did poorly functioning video or telehealth software. Technical support was often absent in these virtual platforms and must be available to both healthcare providers and their patients before and during virtual appointments. Patients were not allowed to choose a preferred platform. This greatly impacted their comfort level and experience with virtual appointments. We recommend allowing patients to choose from multiple platform options. Some complained of long wait times for virtual appointments. A few suggested displaying games, activities, or educational health information pertinent to the patient while they were waiting in these virtual waiting rooms. One suggestion was just to improve healthcare access for the LGBTQIA community during a pandemic, since the inability to get an appointment had left so many feeling hopeless and desperate. Many respondents also felt that their providers could have improved their outreach to patients. For example, they would like their providers to actively check on how the pandemic was impacting their life and to offer more assistance, including increased appointment availability and conveying important information like procedural changes due to the pandemic, hour and staff reduction, changes in appointment format, and even office closures. They also wanted more post-appointment follow-up calls. In general, they wanted more communication from their providers. Our LGBTQIA respondents experienced a significant increase in health disparities due to COVID-19, including a heavier impact on their mental health, a change in health information seeking behaviors and information sought, reduced access to health information, services, and prescription medication. Healthcare accessibility does not commensurate with premium insurance rates. Their accessibility was further limited by the lack of inclusion in healthcare settings. They experienced more virtual appointments with lower satisfaction rates and had an increased reliance on non-public transportation. So they experienced a significant amount of health disparities due to COVID. Thank you for taking the time to listen to my presentation today. If you have any questions, please feel free to contact me at the email listed here, and have a great day.